More on that big political news in a moment. First, though, we begin with a push from doctors and patients across the state who say insurance companies shouldn't get to decide what drugs you're prescribed and when.
They're advocating for a bill that would give doctors a more transparent process when it comes to appealing what's known as step therapy.
Want to bring in our investigative reporter Jennifer Lukey tonight. Jen, this is an issue you've been reporting on for quite a while.
Yeah, it sure is, Ann and Cody. And basically, step therapy is when an insurance company makes you try an alternative, normally cheaper drug first and fail on it before it'll cover the original, normally much more expensive, prescribed drug. Patients say it shouldn't be up to the insurance companies to decide on treatment, but those insurers say if they don't have a say in the matter, all of us will pay more.
Suzanne Carrow has been fighting cancer for 16 years. She and her doctor have worked tirelessly to find the right combination of medications.
I had been on this for a long time, and then all of a sudden they're saying, well, no, you can't, we can't have that. You're going to have to be on all these different drugs.
Scott Daly ran into a similar situation.
Initially, the doctor prescribed Lipitor, and the Lipitor was keeping my cholesterol in check. And then in July of 2010, the insurance company automatically switched me to Prevostat.
From there, Scott says it shot back up. It took he and his doctor years to show the insurance company that the generics they were insisting on were failing.
Why are insurance companies deciding what's best for my patients, a doctor will say?
Well, and I think that's a red herring. I mean, there are processes in place. Every insurance plan has a process where a provider can appeal and say, I know my patient, I know this drug works.
But these doctors say that process is burdensome. They're pushing a bill that doesn't ban step therapy, but speeds up the appeal process and makes it more transparent.
We understand that in certain cases, step therapy is an appropriate option, but there are patients for whom that is not the appropriate way to go.
In the end, when you're asking for step therapy, does it come down to money most of the time?
No, it really doesn't come down to money. It's not about cost, it's about ensuring quality of care for the patient.
Insurers say they only use step therapy in a small number of cases and only when there are generics that prove to be effective. But Suzanne, whose doctor just passed away, is advocating for it to be stopped altogether.
We worked hard for 16 years to get me here, and now he's gone. So anything I do now, I do in his honor.
Obviously a very personal cause for Suzanne, but health insurers say if they were to do away with step therapy, all of us would pay more in premiums because usually medications involved are either part of a trial or brand new. They're expensive and they're also not as proven as some of the other drugs. So Cody, and you can see where the debate comes in is the insurance companies say this is a small number of people that get impacted, and if they were to change it, all of us would pay more.
Any real chances of this changing, though?
Well, this bill has been talked about for several years now. It hasn't really had much momentum moving forward. It seems to have more legislative support now, but we'll have to wait and see.
All right, Jen, thanks so much.